We good? Thank you. Good morning, folks, and welcome to the Legislative Committee on Education and Cultural Affairs. My name is Joe Rafferty, and I am a senator down in York County area, Senate District 34, representing Acton and Lebanon, parts of Berwick, North Berwick, Wells, and Kennebunk. Again, this is a Committee on Education and Cultural Affairs. It is our first day of public hearings, in which we have two. I'll get to those momentarily, but prior to doing so, I'm going to give my committee members an opportunity to say hello this morning. And I will start with my co-chair, Representative Brennan.
Good morning. I'm Michael Brennan. I represent District 36, which is part of Portland.
Thank you, sir. And Senator Woodson, please.
Good morning, Dave Woodson, District 33 in York County.
Thank you. Representative Crockett.
Yeah, good morning, everyone. Ed Crockett, District 43, which is part of Portland and part of Falmouth.
Thank you. Representative Dodge.
Good morning, everyone. I'm Jan Dodge, House District 97, Belfast, Northport, and Waldo. Good morning.
Good morning, and thank you. Representative Lyman.
Good morning, Sheila Lyman, District 74, J, Livermore Falls, and part of Livermore.
Thank you. Representative Millett.
Good morning, Rebecca Millett. I represent House District 30, which is most of Cape Elizabeth.
Thank you. Representative Roach.
Good morning, everyone. Representative Tim Roach, District 7, Wells.
Thank you. Representative Salisbury.
Good morning. I'm Sue Salisbury. I represent House District 35, which is part of Westbrook.
Thank you. Representative Sampson.
Good morning, everyone. I'm Heidi Sampson, yes, whatever my last name is. Anyway, representing House District 21, that is Alfred, Limerick, Chapley, Newfield, and Parsonsfield.
Thank you. And Representative Stearns.
Good morning. My name is Paul Stearns. I represent House District 119, which consists of a dozen towns and the unorganized territories of Piscataquis County.
Thank you, sir. Also working with us this morning, we have our committee clerk is Eli Murphy, and also with us this morning is analyst from the Office of Policy and Legal Affairs is Hillary Risler. So thank you both for being with us this morning. Folks, we have a couple of members of the committee that aren't here yet. They may join us at some point, and when they do, I will give them an opportunity to say hello. Please keep in mind that obviously this is a virtual meeting, and it'll be the method of communication and business as we move through, at least through January. But the purpose of today's meeting is for us to receive information from staff and others in order for the members to consider legislative proposals before them and make recommendations or reports to the legislature. Only committee members, committee analysts, and those specifically invited to attend will be participating in the work session using Zoom. Members of the public wishing to observe this meeting, it is being live streamed on the committee's YouTube channel, and you'll also be recorded for viewing after this meeting is concluded. We are also broadcasting the audio of this meeting on the legislature's website, which is www.legislature.maine.gov. Folks, again, it's a Zoom meeting, but please keep in mind, I like to think of committee meetings as we've all been invited into one another's home. Let's be respectful of that. We have work to do, and we'll try to stay focused as best we can. Following our hearing, we do have the Department of Education doing a presentation in terms of a report that we've asked for. We'll review that after the public hearings are done. We have two public hearings. The first is on LD 1775, and the second is on LD 1780. And as I manipulate my computer, all right. So that said, Um, LD 1775 is resolved regarding the main care funding for Maine schools. And we are going to hear first from Representative Brennan. You want to start us off, or would you like to go to,
No, thank you, Senator Rafferty and members of the committee. Michael Brennan, I represent District 36, which is part of Portland. I'm deeply honored to present the first bill to the Education Committee for this session. And I look forward to further discussions as we go forward. Hopefully everybody has received a copy of the testimony that I did submit, and I don't intend to read the testimony verbatim for members of the committee. But this resolve is the result of the work or review that was done by the committee last year in regards to main care billing. And if you recall, last year, we received a report from MEPRI, and it was entitled Main Care Billing in Public Schools. Thus, the title is a resolve regarding main care funding in Maine schools. It's rare that I get to present a bill that I have a full-fledged report already done supporting the bill and makes the case for the bill. And again, I don't intend to read the entire report, but for you, those of you that do have access to the report, and certainly it'll be available during work session, the first paragraph summarizes the purpose of the bill. And it basically says to understand how Maine public schools can be encouraged to maximize use of Maine's Medicaid program, Maine Care, to increase federal funding for medical services provided to qualified students grades K through 12. Here's the key sentence. School districts are uneven in their main care billing practices, and many are not accessing all of the federal funds for which they are eligible. This could be a significant source of additional revenue to support Maine schools rising special education cost. So basically what the report points out is that even though there is Maine care billing for special education services within the state of Maine and school districts, they are not maximizing those resources, and money that could be used through the Maine care program is now being paid for either by local dollars or by state dollars. And if we did a better job of maximizing Maine care money, we would simultaneously provide property tax relief and also be able to potentially provide more services. Currently, according to the report, only 45% of Maine school districts are accessing Maine care funds. So clearly we have a long way to go. We have a lot of different potential with only having 45%. I'm sure that Representative Stearns and other members of the committee have been familiar with Maine care billing in the past. The report goes on to identify a number of reasons as to why we only have 45% of schools that do access Maine care. Part of it has to do with just infrastructure issues. Smaller, more rural school districts don't have the staffing, don't have the infrastructure to apply. Secondly, we've also experienced in the past 10 or 15 years ago where there was a clawback due to audits in Maine care. And that was very disconcerting, disturbing for school districts that were subject to those audits and subject to those clawbacks, and made them obviously much more reticent to apply for Maine care now because they may be subject to audits going forward. I've also, I have to say, I mean, I've read hundreds of state reports, and in this report in particular, I've never seen the word confusing and complex used more often. And that's typically how people describe Maine care: confusing and complex. And if you look at page 16 in particular of the report, it uses the word confusing to describe how a school district might apply for reimbursement for mental health services. And it goes on to, in detail, to describe why it is in fact confusing. I've had the opportunity to serve for 4 years on the Health and Human Services Committee, and I also chaired a Blue Ribbon Commission on Main Care Reform. It is confusing, it is complex, but if you're able to work through that confusion, work through that complexity, the potential financial benefit to Maine school districts and to Maine students are enormous. And in particular, as we've seen rising demands for mental health services, this could be a key source of revenue for local school districts to expand those services, particularly when federal funds become less available. So again, I won't, people have access to the report and they can go through the report. And I think the overall message is still the same. We could be doing a better job in Maine. There are more resources available and there are more services that we could provide. The bill itself is resolved because I don't believe that this requires a considerable amount of study by the Department of Education or the Department of Health and Human Services. This is just something that we need to do. Now, I've spoken extensively with the department about this, and as you know, the committee last year authorized through LD 135 asking the department to move forward with the HHS to develop a unified billing system for Maine Care as it relates to the CDS system. We're going to get a report back on that fairly soon. And I think the department hopes to use that as a prototype to then move forward to look at Maine Care billing procedures for the entire K through 12 system. So as a committee, we might want to hold off on a work session on this particular bill until we hear the report back on LD 135 and as it relates to CDS, because there hopefully we will see a better working relationship between DHS and DOE in regards to Maine Care and Maine Care billing. But as we go through this process, I think it's important for the department to consider a number of things. One, and it's pointed out in the report, there needs to be a better definition of services that are available. States do have flexibility in terms of what they provide and they don't provide. Some states provide more services than Maine does, others don't. We need to work through that issue. Secondly, and I think you'll hear testimony, there has been testimony submitted that there needs to be work done on defining what staffing, professional staff is eligible for Maine Care reimbursement so that is also clear. There's the huge issue about seed money. And as many of you know, the federal government reimburses about 66% of Maine Care services called the FMAP rate. And then the state has to provide the additional 35% of quote seed money. Currently, what happens is the Department of Education subtracts that seed money from school district subsidy in order to cover that cost. We need to have a discussion, the state needs to have a discussion about whether or not it wants to fully fund that seed cost or whether or not it wants to continue to have the local school district continue to contribute or be part of that seed money. And then lastly, I'd offer as language an amendment in the bill to make sure that it's very clear that DOE needs to work with the Department of Health and Human Services. Maine Care billing funding and everything does come through the Department of Health and Human Services. And obviously working in a collaborative way with DHS is going to be critical to moving forward. So I just think this is a win-win-win proposition that the better we do around Maine Care, it means that we're doing better for students, it's doing better for school districts, and we're also doing better for taxpayers because we're maximizing resources that now are being paid locally or with state money. So I think all of you would agree that one of the reasons that we have MEPRI is to have them do research on key issues, and then we can line up legislative suggestions or legislative proposals in keeping with the research that's done by MEPRI. And that's what I'm trying to do with this particular bill, is to say we received a report from MEPRI that provided a unique opportunity for us to move forward in this area. And hopefully we can take this report, we can take this resolve, work with DOE, work with DHHS, and next year at this time, we'll have a better billing system through MaineCare. So thank you very much. And within the limited understanding that I have of MaineCare, I'm more than happy to answer any questions that you might have at this point.
Thank you, Representative Brennan. I don't see any questions at this time, but that was, thanks for that.
And is that because everybody is totally confused by the complexity of MaineCare?
It's possible, but we hope that we can get you some help here. We do have some folks in to testify.
Well, thank you.
Thank you, sir. Believe there's only 3, and it appears all are in favor of 1775. The first up would be Eileen King, please. Good morning. Good morning.
Good morning, Senator Rafferty, Representative Brennan, and members of the Education and Cultural Affairs Committee. I am Eileen King, Deputy Executive Director of Maine School Management Association, testifying on behalf of the legislative committees, the Maine School Boards Association, and Maine School Superintendents Association in very strong support of LD 1775. There's a documented history of billing and funding problems with MaineCare services that date back through several administrations and require a comprehensive approach. Problems have been identified and solutions proposed, but there are still issues in the field. In speaking to special education administrators, the feeling is many SAUs don't bill because of the complexity of the billing system and the time and effort involved. There is also concern that some districts had to pay back money because of confusion around the rules about providing medically necessary services in a school setting. A checklist interested parties put together back in 2012 illustrates the long-standing need for updated procedures to improve the billing system. Items on the checklist include a request to the state to do the following: compile a comprehensive list of services provided by schools that could be eligible for a reimbursement. This should include a description of service, who is providing that service, and in what setting, what is being contracted out, and what are the qualifications of those providing the service, such as certification and licensure. Provide for schools a list of medically necessary services in language understood by educators, and more DHHS training on sessions on billing. We want to recognize that training has improved over the years, but more work is still needed on the complicated billing process. As one superintendent put it, I stopped billing when we began to lose money. It's a tremendous amount of work for very little return. Plus, whatever you collected, a portion of the return was deducted from your special education funding. I have never figured that out, nor has anyone successfully explained it to me. This bill would direct the Department of Education to develop a comprehensive system to support school districts in seeking Medicaid reimbursement for Medicare eligible services that is clearly needed for our students. Thank you, and I'd be happy to answer any questions.
Thank you. Any questions? Yes, Representative Millett has a question.
Thank you, Mr. Chair. So we are, as was mentioned earlier, looking at this issue within the context of CVS. And within that framework, what we've kind of initiated is investigating or trying to put in place a centralized billing system so that the districts actually themselves aren't burdened with having to bill. Whereas this resolve seems to maybe put it back into the hands of the districts. I'm wondering if you and your members have a preference in approach.
Representative Millette, is that for me?
Yes, it is.
I think a centralized billing approach would absolutely be easier for our members. If you look nationwide, the districts and statewide, the districts that were able to hire a third-party consultant are those districts that are benefiting 100% from Medicare reimbursement. The inequities begin to surface when you have your small rural districts that don't have the wherewithal and the financial structure to hire people to do the billing. My example, I had Medicare billing came in. I needed 2 staff. I had to hire 2 staff to do the billing. It was still very complicated. And it was going to cost me more money to hire staff to get the reimbursements. Then the confusion regarding the definitions of school-based reimbursements versus medical reimbursements. Our staff doesn't have that medical knowledge and background to kind of wade through that. And speaking to a superintendent yesterday of a large district said, I just reimburse for speech because that's the easiest one to do. That's clear cut. So I think a comprehensive approach would be a systematic comprehensive approach would be very supportive for school districts. So that's a long yes.
Thank you. Any other questions, please, of Ms. King? Seeing none at this time, thank you very much. We appreciate you being here today and your testimony. You have a great day.
Good to see you all.
Next up on my schedule was Michael Dixon. I'm not sure if Michael's with us.
Senator Rafferty, I have sent the invite to Mr. Dixon to join as a panelist. However, there's been no response. So for now, we could move on to Nancy Cronin, who I believe is available.
Thank you. I appreciate that. Sorry, Nancy, for any confusion.
No worries at
Good
all.
morning.
Good morning, Senator Rafferty, Representative Brennan, and distinguished members of the Joint Standing Committee on Education and Cultural Affairs. Happy New Year. My name is Nancy Cronin. I'm the Executive Director of the Maine Developmental Disabilities Council. I stand very much in favor of this bill. In general, I also stand in favor of a centralized system in which it is easy, comprehensive, and clear for schools to be able to bill in a clear way. So we're not having to learn every individual school how to do this, which seems unwieldy at best. I will give you a very quick example of how this might be helpful. Imagine an 8-year-old child, for instance, who may have autism, who has severe functional needs and attends a local school. This child could easily receive speech therapy, occupational therapy, specially designed instruction, consultation with a psychologist or a board-certified behavior analyst, and likely receive support by a paraprofessional. Looking at how other states do it, it is easily logical that the school would be able to reimburse for speech therapy, occupational therapy, some of the psychology and board-certified behavior analyst consultation, and some of the paraprofessional time. Not all, which is why, yes, we need to make it very clear what can you be reimbursed for and what can you not reimburse for. Medicaid can help funds provide for medically necessary services for IEP. And yes, there is a chasm between what's educationally necessary and what is medically necessary. But it could also look at school health services. And when we look at the pandemic, that might have been helpful, especially when we consider the nursing issues that we've had. Salaries to provide medically necessary services, assistive technology, and durable medical devices. For instance, when there's children with special healthcare needs, who needs things like feeding tubes, all could be reimbursable. The MEPRI's report did a fantastic job explaining all the challenges. And so did Representative Brennan. So none of this is really new. the biggest challenge is that DHHS manages main care, DOE manages education. There are two different legislative committees as well who manage what should be in the Medicaid state plan and what should be in educational policy. So it's very clear that we need joint negotiations of a methodology that will work for both departments. And it's also clear, as there's going to be varying priorities, that there's going to have to be negotiations and compromise, but it's possible. And this is not uncharted territory at all. Many states have chartered these waters. So it is possible, it is doable, and it is time. So whether or not we braid, blend, or streamline funding, MDDC is all in favor and is more than happy to do anything that you would find useful. Thank you very much for your time. Happy New Year again.
Thank you. Do we have any questions for Ms. Cronin at this time? Seeing none, Nancy, thank you very much. We appreciate you being, oh, I'm sorry, Senator Woodson.
Not necessary question for Nancy, but everybody has brought up some very good points here. And we keep going back to a key part of this success is DHHS. Have we had any communication with them and how they're working on this issue? I mean, have they weighed in? Does anybody know what's transpiring on the other side of this?
I don't have the answer to that, sir, myself.
Senator Rafferty, if it's okay. Trista Collins is the main care representative whose job it is to manage and work with DOE and DHHS and be that link. You folks actually funded her position about 4 years ago, and she is in constant relationship between 7 years ago. I knew it was a long time ago, but she does exist. And she put together a rule for DHHS, section 106, about 3 years ago, and it became very challenging. So it was put on the back burner. I believe she's trying to put that out again. So DHHS is working on it. There is a rule out there, but once again, there is complexities with what has to be put on an IEP plan so that it can be billed on Medicaid. And that's been the source of the challenge, is around essentially documentation among these two different systems. But as I said before, this is doable, but it's going to take a tremendous amount. It's going to take a tremendous, no, not at all. It's not going to take tremendous. It's going to take a little bit of political will.
Big challenge. Now, thank you, Nancy. What is Krista's role? What's her position?
Krista, I believe Trista Collins is the DOE, is the Education Medicaid Liaison. I believe that's what her job is.
Okay. Thank you.
Krista with a T.
Yeah. Thank you. This is a very big area, and we got to make sure it's addressed.
Thank you, Senator. I have an additional question from Representative Millette, please.
Thank you, Mr. Chair. This is actually a request for the work session that we, hopefully Ms. Risler, our analyst, can provide for us an overview of these other states that have done this. How long the process took, what were the organization stakeholders involved, how did it look, how long did it take? And if we could also have Trista join us as well, that would be, I think, very informative. I think I don't believe we have ever heard from her here in the committee. And I'm hoping that we can help start to bridge this divide between education and health and human services in this particular bill. Thank you.
Thank you, Representative. Any additional questions, folks, at this time? Yes, Representative Dodge.
Thank you, Mr. Chair. I would also ask our analyst, or perhaps ask you guys as chairs, please, should there also be the equal component person from DHHS present at our work session to make sure that we have the knowledge in the room, please? If that's appropriate, I would ask that that happen, please. Thank you.
Just so I'm clear, Representative Dodge, so you want a representative from the DHS at our work session, just for clarification on any questions?
Obviously, you as chairs perhaps know best, but if there is a matching person or specialist on this in DHHS, I believe it would be valuable to have them there if you folks think that that is appropriate. Thank you.
Thank you. Hillary.
Thank you. Yeah, I just wanted to mention that, yeah, I will work with Erin Fraser in the Department of Education and her counterparts in DHHS to make sure we get anybody who has their expertise in this area available for the work session.
Thank you. And in the meantime, Representative Salisbury has a question.
More comment as we get ready to do the work sessions. I hope that as a group is convened to address some of these issues or answer some of these questions, that the actual stakeholders, the superintendents and the people in the schools that are actually having to bill or work on these are invited as part of that. Because again, it goes back to if they don't understand or it's confusing or complex, then it's not going to be done adequately. So I really hope that we continue that in that vein of having them a part of that.
Thank you, Representative. That makes sense. Any additional questions, folks, at this time? Okay.
Senator.
Yes,
I'm
sorry.
Just jump in. I'm sorry. To follow up on Representative Salisbury, could be the superintendent, or perhaps even better, the business manager, somebody who's actually working with this situation.
Thank you very much. That, again, does make sense for us to have.
Okay, so
Any additional questions? Seeing none, I want to thank you, Ms. Cronin, for being here this morning. We appreciate you testifying and you being available. We do have an additional person, Mr. Dixon. Good morning.
Good morning. Thank you. I'm newbie here, so I didn't realize that I needed to sign in order to be seen. I was in here and I heard you say I wasn't there, so fortunately I figured it out that and somebody saw me and invited me in, so I apologize for that. I have a I think this is very good policy and very good practice, what you're doing, and I support this 100%. I'm aware that there are some potential problems for school psychologists in that need to be addressed. And so I wanted to come in and talk about that a little bit. I actually sent you a kind of a long letter with lots of attachments to it. And I don't know if they've been read yet or will be read. I also spent a long time talking with Representative Brennan the other day and expressed some of my concerns to him. And what my concerns are is that if you look at the main care benefits manual, you will find that the only people who are designated school psychologists who may be reimbursed for their services are people who have a license from the Maine Board of Examiners of Psychologists, either as a psychologist or as a psychological examiner. And the first thing I attached was section 13022 from Title 28, Chapter 502, Credentialing of Educational Personnel. And I actually said that in and of itself said that there would be other school psychologists who are not covered by Medicare, Medicaid. What I'm aware of is, after I've spent a lot of time reading this, that I'm not even sure that's true. You know, there is something that says we have to have a license to be credentialed. Unfortunately, or I don't know if it's unfortunately, because we have a severe shortage of school psychologists, the credentialing for school psychologists, which is the 0936 certificate, gives people who aren't who don't have a license from the Maine Board of Examiners of Psychologists pathways to become school psychologists, which means none of those people are included in the Maine Care Benefits Manual. And so I think some of this needs to be tightened up and straightened out. I wonder if you shouldn't ask your legal analyst to look at section 13022 and then compare it to the requirements for school psychologist certificate 093 and see how we end up with some people who will be covered and some people won't. So I'm afraid that it's going to kind of impact the usefulness when it comes to school psychologists. As I said, we already have a severe shortage of school psychologists. So just saying, well, the people who don't have that license just can't be school psychologists anymore. They've been school psychological service providers in Maine since '93, when that when the rules regarding that came into effect. With 180,000 children, the Department of Maine DOE tells me that we only have 217 school psychologists for the entire state, which is much lower than what is recommended for the number. It's about one for school psychologists for every 832 students. That's only going to get worse when public schools take over pre-K, because they'll be coming on board and many of them needing services to early childhood services and pre-K services, which are very important. So I'm going to stop here and ask if anybody has any questions and do my best to answer them. I really appreciate your allowing me to come in, even though I missed the first call.
No problem, sir. Do we have any questions of Mr. Dixon while he's here? Yes, Representative Dodge.
Thank you, Mr. Chair. Good morning, Mr. Dixon, and thank you for being here and sharing your testimony and thoughts. Would it be possible for you to please explain your professional affiliations or position, please, to the committee? Thank you.
Certainly. I am a psychologist, which means I have a license from the Maine Board of Examiners of Psychologists. I'm also certified as a school psychologist by Maine DOE, and actually I'm not standing on formality, but it's actually Dr. Dixon, but I'm perfectly comfortable with Michael. So that's who I am. I've been practicing in Maine since 1974. I've been a school psychologist. Actually, I'd be happy to send anybody on the committee who wants it my streamlined professional resume, which I thought might be over the top for me to include it with my testimony, but I've been doing this for a long time and I've been on the scene for a long time. So I know some of the ups and downs and ins and outs and of school psychology, and also during that time I was mostly in private practice, and I was a Medicaid provider, main care provider, so I had to navigate that system. And I agree with Representative Brennan that it's confusing and complex, and I'm looking forward to getting the NEPRI report so that I can read it myself.
Thank you very much, sir. Any additional questions, folks, at this time? Seeing none, I just want to say thank you. You have a nice day, sir. We appreciate you being here.
Well, thank you for having me, and good luck in getting this through and putting all the departments together, because I think it's also going to take a licensing board, maybe a new licensing board for school psychologists, as well as things, maybe changes that the insurance commissioner will have to deal with as well, in order to maximize the use of school psychology services. And I put some recommendations about that in, changes to the main care manual that I think should be considered as well. So that's all in the written testimony that I handed in last night. So thanks again for having me, everybody, and you guys all have a great day.
Thank you. You as well.
Thanks.
Before moving on any further, we did have a committee member that was able to join us during our testimony. Good morning, Senator. How are you?
Good morning. Apologies for being late at other meeting, but excited to be here. And I am Senator Maddie Daughtry, and I represent Senate District 24.
Thanks very much. We appreciate that. So I am going to close the public hearing on the resolve 1775 regarding the main care funding for Maine schools. So that is closed this time. And next up, and I will just give a heads up, I don't think I did earlier. For those that are planning on speaking this morning, there is a transition period between when I say your name and you actually appear with us. So be patient. You'll get there. You'll be in electronic limbo for a little bit, but we'll get you up and running as best we can. So thank you. At this time, I'd like to open the public hearing on LD 1780, which is an act to allow unorganized territory school staff to receive annualized pay. That is at this time, I see a hand up. Good morning. Yes, Representative Stearns.
Thank you, Mr. Chair. I might have been zoned out, but did you close the last hearing?
Yes.
You did? Okay, good. I must have been.
That's all right.
I think my brain might have been frozen up here this morning.
Well, it's possible that I'm on a zone occasionally myself, but I believe I did. Close that one and open this one. So we're good to go. That said, of course, I'm using a second screen that just happens to click off as I need it. So this morning, is Representative Dunphy here? Eli, do you know? Oh, I'm sorry. Yep. You appeared before I even asked. Thank you. Good morning.
Good morning. Nice to see everybody today.
Thank you. We appreciate you being here to speak on behalf of 1780, and we will give you the floor.
Again, good morning, Senator Rafferty, Representative Brennan, and esteemed members of the Joint Standing Committee on Education and Cultural Affairs. I'm Michelle Dunphy, and I represent House District 122, which is comprised of the City of Old Town in the Indian Island voting district. And I also have the distinct honor of serving as the House Majority Leader. And I'm here today to present LD 1780, an act to allow unorganized territory school staff to receive annualized pay. This bill would allow unorganized territory school staff to have the option to receive annualized pay. And as we all know, employers, including those in the education community, are struggling to find good, qualified candidates to fill open positions. Those working to provide adequate staff to support our children in unorganized territories are no different. Currently, these schools are at a disadvantage for hiring quality staff, as there are many surrounding districts who provide this option to their employees. This option would give teachers and critical support staff, such as ed techs, bus drivers, and janitors, the opportunity to receive a consistent year-round income. And this also means they would not have to decide between foregoing insurance coverage during the summer months or paying costly COBRA premiums to maintain insurance for themselves and their families. And as a former teacher, I know how dedicated our educators and support staff are. They choose to spend their career supporting, caring for, and continuously going above and beyond to do so. And we can't ignore the fact that teachers and support staff have children and families of their own that also need to be supported. And without an even playing field among the districts, both staff and students may suffer. With this bill, we have the opportunity to better support our teachers who deserve to have equal access to consistent year-round income as much as any teacher in the neighboring district or any district. And I urge this committee to support LD 1780, and I appreciate the opportunity to share my thoughts with you, and I'm happy to answer any questions.
Thank you very much. We do have a couple of questions. Representative Stearns, followed by Senator Daughtry and Representative Salisbury.
Thank you, Mr. Chair. Good morning, Representative Dunphy.
Good morning.
Is the gist of this that, of course, the unorganized schools are run out of the department. Is the gist of this that they haven't historically been able to do this in the past, and that there's some added burden on them to be able to do the paperwork to make this happen? Because it's quite common in the local school systems.
I don't know why this hasn't happened before. I don't know.
If I could follow up briefly, Mr. Chair, and sort of a question, but I'm hoping that for the work session that we could have the commissioner for the unorganized schools available, the superintendent, so that we can maybe look into that and see if that's just an easy fix.
Thank you. Senator Daughtry, followed by Representative Salisbury, please.
Thank you so much, Mr. Chair, and good morning, Representative Dunphy. Always a pleasure to see you. This is a question I think probably more for our analysts, but I'm wondering for the work session if we could sort of get the history of how this ended up on the books. It feels like a very strange requirement, considering that surrounding school districts are able to do this already, and many other positions within education and public sector are also able to do this. So if we could just sort of get the history of how the heck we ended up at this point, that'd be great. Thank you.
Thank you. And Representative Salisbury, please.
Thank you. What Maddie just said. Basically, I didn't know if it was just something because I'm new onto this committee or unfamiliar, but I was just wondering how this has come about. So thank you.
Thank you. Folks, any other questions at this time for Representative Dunphy? Seeing none, we want to say thank you for being here today. We appreciate you joining us and for your testimony. And good
Thank
luck
you. It's
moving
nice to see
forward.
all of you.
You as well. Have a nice day. We do have some additional testimony coming in, and I have Jeff McCabe, Robin Upton Sukforth, and then I believe President Jackson potentially. Is President Jackson up? Good morning, sir.
Morning, Senator Rafferty, Representative Brennan, and distinguished members of Joint Standing Committee on Education and Cultural Affairs. My name is Troy Jackson. I represent the good people of Northern Mercer County and Senate District 1. And I'm here today to support LD 1780, an act to allow unorganized territory school staff to receive annualized pay. As this committee is likely aware, there are 3 schools in Maine's unorganized territory: Connor Consolidated School in Aroostook County, the Edmonds Consolidated School in Washington County, and Kingman Elementary School in Penobscot County. Much like other public schools in the state, the staff at these schools provide quality, regular, and special education that aligns with the system of learning results, meets all standards for elementary and secondary schooling, and complies with other standards established by the Maine Department of Education. While administrators, teachers, and education technicians working in unorganized territories have to follow all the same rules as their peers, they don't get the same flexibility and benefits. This bill is about equity and rectifying the situation. The hardworking teachers, education technicians, and administrators working in Maine's unorganized territories deserve the same wage payment options as their colleagues do that have the same work in other parts of the state. The problem is technical. When Title 26, Section 632A, subsection 4 was expanded to school administrative units. In 2019, the educators in the unorganized territory were not included because these school districts are not considered an SAU as defined in Title 20A. As a result, the educators and staff in unorganized territories were not granted the option upon written agreement to schedule the payment of wages over a 12-month period. This can create a hardship for those who work in the unorganized territory and gives them less flexibility and choice than their colleagues. In Northern Aroostook County, I represent the Connor Consolidated School in Connor Township. Throughout my time as the legislature, I've had a chance to visit with the staff, tour the facility, and meet with the students there. Every day, this small but mighty staff goes above and beyond to meet the needs of their students. The staff includes 4 teachers, 2 educational technicians, a secretary, custodian, food service director, and a bus driver. 70% of the students qualify for free and reduced school meals. All the teachers and educational technicians are certified. Their passion and commitment is simply inspiring. If we truly believe that every child in Maine deserves a first-class education, then we should ensure that all school staff can access the same benefits so rural schools in Maine's unorganized territories can attract and retain first-rate staff. I definitely want to thank House Majority Leader Dunphy for bringing this bill forward. I urge the committee to join in supporting this bill. And I thank you very much for your time today. I certainly take any questions.
Thank you very much, sir. Do we have any questions of President Jackson at this time? Seeing none, just want to thank you very much for being here. We appreciate your testimony and joining us this morning. Thank you very much. Have a good day. Next up is Jeff McCabe. Good morning, sir.
Good morning. It's my first testimony via Zoom for 2022, so it's great to be back. Senator Rafferty, Representative Brennan, members of the Committee on Education and Cultural Affairs. I am Jeff McCabe. I serve as a legislative and political director for Maine Service Employees Association. We are a labor union representing over 13,000 Maine workers, including the workers at the schools in the Maine unorganized territories. I have about 3 pages of testimony. I will not read that all before you today. I did want to start off by taking a moment to thank all of the teachers, all of the school staff across the great state of Maine. It continues to be trying times. I say this both as a parent and a citizen of this great state, and it's pieces of legislation like this that give us an opportunity as the state of Maine to step up and do right by those working in Maine schools. This legislation is necessary first as a step for the state of Maine to begin addressing a critical problem that is impacting these workers. You've heard a little bit about what these schools represent the communities that they are in. And I wanted to thank Speaker Jackson for taking the time to meet with students and staff at one of these schools. I also wanted to thank Majority Leader Dunphy for bringing this bill forward. This is a bill that came out of bargaining that took place this summer. The executive branch contract was bargained throughout summer of 2021. As part of that process, there was a break off and some small table bargaining, which is a way to try to address site-specific, work site-specific needs as contract bargaining. Often this will be done in areas such as the Department of Transportation and others. But you'll hear today from Robin Upton-Sukeforth, who is a field representative for MSCA, who was part of that bargaining and really instrumental in hearing the concerns of these staff coming forward. I also wanted the committee to think a little bit about some of the folks that are working at these schools. You did hear a little bit about some of the job titles. We're talking about staff that includes janitors, bus drivers, teachers' aides, substitute teachers, and then also the folks that work in nutritional services, which are outside of the MSCA bargaining unit, but are part of the ASME union and bargaining unit. And I have had an opportunity to talk with ASME. This is also a great deal of concern for the folks that they represent in these schools as well. You also should have written testimony from Angela Jones, who is a member of our union, a substitute teacher at Edmonds Consolidated School, and who participated in the bargaining team negotiations over the summer. You also have testimony submitted from the Edmonds Consolidated School teaching principal, Trudy Newcomb, and these are great resources, and I would encourage you to use myself as a resource, Robin, who you'll hear from today, is a resource, as well as our members. And one final note, you should know that because these workers at these state-run schools have a reasonable exemption of returning to their jobs with the start of each school year, they're ineligible to collect unemployment insurance over the summer. So they're expected to cover 100% of premiums associated with COBRA or other insurances that might be associated with this job. So with that, I'm happy to take any questions, and I will be available to the committee for the work session in between now and the work session as well.
Thank you, sir. I see a question from Representative Stearns.
Thank you, Mr. Chair. Thank you for being with us this morning, Mr. McCabe. I don't know if you can answer this or not due to confidentiality rules in collective bargaining, but was this particular point brought up at the table and did not make it through into the final agreement?
Thank you, Representative Stearns. I had anticipated this question, and I thought it might come from you as well. And I do have an answer, and you'll hear more from Robin as well. And this was something that was brought up at the table, and it was suggested that statute needed to be changed for this to be something that could be bargained at the table, as well as the possibility of making this available to folks. So I hope that answers the question.
It did kind of, but you mentioned that the statute would be changed so that this could be brought up during negotiations, but it already has been brought up during negotiations. So we're looking at a legislative fix on the thing.
Yes, sorry, Representative. Actually, the statute is needed to be changed to allow this to be bargained.
Oh, okay. Thank you.
My understanding. And I'm also curious and would be happy to work with DOE and the analysts to see if this is something that the legislature could enact. As well, or if it's something that when the statute's changed, it will still need to be bargained. I imagine it's things like this and other things that are going to continue to complicate, filling and retaining school staff in these EUT schools. We've had challenges here associated with wages, and I would encourage the committee to ask those questions of Robin as well. The state just implemented a $15 minimum wage as part of the executive branch contract negotiations last summer. I think this committee, and I know we've talked about it in the Labor Committee, would find it very concerning if you looked back at a year or two and saw how many folks in the executive branch were being paid under $15 an hour. including folks at these schools. It's a real challenge to, as you're well aware, to recruit and retain folks in education across the state, and the EUT schools are not, not left out of that calculation.
Thank you, sir. Any additional questions of Mr. McCabe while he's here, folks? Seeing none, sir, thank you very much. We appreciate you being here and for your testimony with us this morning. Have a good day. Next up is Robin Upton Sukeforth. Good morning, Robin. Robin, you may be muted. Robin, you may be muted.
Can you hear me now?
No. Do you have a speaker on those earphones?
The earphones are not working. I'm on a computer. Let me try it on the, try something.
We can hear you slightly. If there's any way to increase the volume, that would be helpful.
Is this any better?
Yes, it's getting there.
Okay. Excuse me, I'm working from home and my husband works night, so I'm gonna wake him up. Okay, good morning, Senator Rafferty, Representative Brennan, and members of the Committee of the Education and Cultural Affairs. I'm Robin Upton Sukeforth. I'm a field rep for the Maine Service Employees Association, Local 1989. We are a labor union representing over 1,300 Maine workers, including workers in the schools in the Maine unorganized territories. We're here in support of LD 1780. I'd like to provide you with some COBRA insurance costs that are the reality for most of the workers at the 3 state-run schools in Maine's unorganized territories in order for them to keep their insurance uninterrupted each summer. As you may know, COBRA stands for the Consolidated Omnibus Budget Reconciliation Act, which provides workers and their families who lose their group health and benefits provided by their employer the right to continue group coverage for a monthly fee. As you have heard, the workers at issue in LD 1780 are employed at the 3 unorganized territory schools. The COBRA insurance cost relates to the state's suspension of the employer's share of health, dental, and vision insurance premium for those workers from the last day of the school year to the first day of the following school year. Currently, those school workers have no choice but to pay for COBRA all entirety out of their own pockets in order to continue their own and their family insurance policy every summer. You need to know that the state's suspension of the employer's share of insurance premiums every summer creates enormous medical and financial problems for these workers, all of whom are low-wage workers. Most aren't even scheduled for a full 40 hours a week during the school year. Instead, many are scheduled for 32 to 37 hours per week. Unlike employees in the Maine public school districts, on the last day of every school year, workers at these 3 state-run schools brace for the state terminating their health insurance until the start of the next school year. In order for most of these workers at these 3 schools to continue their employer-provided insurance every summer, they must pay 100% of the COBRA insurance premiums, starting the first day and continuing till the first day of the school year. While LD 1780 in itself won't solve this problem, passage would make it possible for the workers and the Mills administration to negotiate year-round pay for these workers so that the current suspension of the employer's share of insurance premiums every summer can also be addressed. I can give you some cost. Monthly cost for COBRA for an employee only is $986.36. If you were to look at a family, it's $2,462.18. That's just for health insurance. There's also the cost for dental insurance. So if you have anybody with braces, you want to keep that going during the school year. There's also the vision insurance, and those costs come totally out of that employee's pocket. Based on those costs, workers at the 3 state-run schools who have employer-provided family health, dental, and vision insurance must pay $2,576.20 per month in COBRA premiums just to continue their employer-provided insurance. The COBRA premiums cannot be prorated. These workers must pay 3 months of COBRA premiums to keep their insurance uninterrupted. The total cost for one worker per summer is $7,728.60 for 3 months of family COBRA, dental, health, and vision, because the state has suspended its share of the premiums for employer-provided insurance. That's an untenable situation for these workers. Like many of us, these workers and their family members have medical conditions with treatment regimens and appointments covered through insurance. They simply cannot afford to go without insurance, especially during the ongoing COVID-19 pandemic. Yet some of them are in fact foregoing insurance every summer. The state suspension of premium contributions for these workers every summer is disrespectful to the students and the families who are counting on this insurance. These students are being taught under a structure that already deviates from other public school districts in Maine, as there is no local school board for parents or other community members to approach to address issues at the state-run schools. The ongoing recruitment and retention issues at these schools is real, and it must be addressed. We brought up this issue of annualized pay with the Mills administration, the executive branch bargaining last year, and the response we got was to address it through legislation. That's why we're supporting LD 1780, and we respectfully ask for your support as well. Thank you, and I will be glad to answer questions. And I was very nervous, so I skipped over some of it, but I can answer the questions.
Well, relax. We'll try to keep, we'll find you a comfort zone for you.
Okay.
Senator Woodson, followed by Representative Stearns, please.
Thank you. And thank you, Ms. Sukva. Interesting situation. So it sounds like to get annualized pay, it needs a statute change. But that's not going to solve the issue of paying for the insurance over the summertime, is it?
What it will do is it lets us have the option of annualizing the pay, and it will also give us the option of negotiating how to do that, which could then extend the benefits, similar to public schools. You have ed techs and nutritional staff in public schools who don't work through the summer, but their cost of insurance is carried through the summer. And this is the intent that we were looking for when we started this negotiation.
Yeah, I mean, the amount of money that it takes for those poor folks to pay for the summer on insurance, I mean, that must take half or a third of their pay. That's ridiculous.
The difficulty is that they're also paying during the school year for a portion of it. If they have family coverage, they're paying also a portion of it, and they're now responsible during the summer. And even if they were to earn minimum wage, which is what now, $12 and some odd cents, they're not going to make that money up during the summer working a summer job.
Yeah, thank you very much.
Thank you, Senator. Representative Stearns, please.
Thank you, Mr. Chair, and thank you, Ms. Upton Sukfor, for being with us. And certainly don't be nervous amongst this group. We're all here to help solve problems. I do have a question for you. Out of the large state group that you are representing, are there other seasonal employees? And we're talking hourly employees. Are there other groups that work seasonally and then are also put into this situation besides schools?
Generally, you would have issues with like people who work in the state parks. that would be considered, but I can't speak to them. I can tell you that when I look at these employees at the unorganized territories, they're called intermittent employees, which kind of throws the wrench in their insurance coverage, just like it does for seasonal. Yes.
Oh, okay. If I could have a follow-up, Mr. Chair.
Yes.
Yep. Thank you. I suspect this bumps its head on wage and labor law too, where a person has to be paid in a timely manner for the work done on time. So, is it safe to say that this is less about the hourly, annualization of the hourly pay, and more about insurance coverage?
It's a combination of the two, because when we started talking about how to figure out how to do this, the annualized pay, we were, and Speaker Jackson mentioned the particular laws. When we were talking about it in negotiations, to be honest with you, I brought it up 3 times. Okay.
Yeah.
And each time I was simply told it's against the law. And
right.
twice I very specifically asked which law, and they would not give me the reference. Okay.
Okay. Thank you.
We did find it, and I can say that this is the same. If you were to look at public schools, there are nutritional people and ed techs who do not work 40 hours, and they are annualized pay.
Right.
Okay, so that bump, you're talking about a wage and hour thing, that can be done through a contract.
Yes. Yeah. Okay. Thank you.
Any additional questions? Senator Woodson? Oh, okay.
Sorry, I didn't lower my hand.
No problem. Seeing none, Robin, we want to thank you for being here this morning. We appreciate your testimony and your expertise, and good luck with this moving forward. Representative Dodge, I'm sorry.
Thank you, Mr. Chair. This is about for work session. I am hoping that our analyst will have a labor person who can be in consult with us as we work this through, please, and thank you very much.
Thank you. Yes, Hillary.
Thanks. Not working as much with some of these labor issues. Is there someone you have in mind? Maybe you don't know right now, but if there's someone on the committee who thinks would be helpful, that might be helpful to me to make sure I can track down the right person. I'm not sure off the top of my head who that would be.
Do we have a specialist who combines education and labor law in OPLA who would best be able to advise you? No?
No.
Inappropriate question, sorry.
I mean, I can certainly talk to both my colleagues in the staff labor and who staff the healthcare insurance coverage committee and get what information I can. But if there's someone specific that you have in mind, I'll need a little more information.
Okay, thank you. Sorry.
Any other questions or comments relative to? And all right, before we move forward, then I see, oh, maybe he's gone. All right, Representative McCray, good morning, sir. How are you?
Yes, I'm fine. Thank you. Thank you, Mr. Chair. I've been over in another committee over in ACF, and I had trouble getting the link there also. But I'm up in Fort Fairfield, very cold morning, 18 below. Supposed to get clear up to 4 below before the day's out. So glad to be here. It's nice and warm. So thank you.
Well, thank you, and we're glad you could make it. 18 below is a bit on the cold side. Seeing no other questions, and I'm not aware we've been through all the testimony, so I am going to close the hearing relative to, of course I lose the number here. And that would be LD 1780. So the public hearing on LD 1780, which is an act to allow unorganized territory school staff to receive annualized pay, is closed at this time. Thank you, folks, very much. And in terms of the hearings portion of our committee meeting this morning, that has ended. We do have the Department of Education coming in to give us to report out relative to graduation rates this morning, graduation and retention rates. I see, Hillary, do you have a question?
Nope, sorry, I just forgot to lower my hand that time.
Oh, that's all right. So, is it, who's going to start this morning? Is it Jackie?
No, it should be Jason Libby, who's
Jason,
our
okay. Yeah, I
higher
do.
ed. There he
All right.
is.
Good morning, Mr. Libby. How are you?
Good morning. I'm doing well. Thank you very much.
Good. Well, thank you for being here, and you're welcome to get started.
Well, thank you, Senator Rafferty, Representative Brennan, distinguished members of the Education and Cultural Affairs Committee. My name is Jason Libby. I'm the Post-Secondary and Educator Preparation Coordinator for the Maine Department of Education, and I'm here to present to you the report on retention and graduation rates. Do I have permission to share my screen at this time?
Please do so.
Thank you. Are you all able to see that?
Yes, sir.
Wonderful, thank you. This will be a brief report out. This is a very clear report. It's meant to inform this committee and others on publicly available information that's self-reported by certain post-secondary institutions of higher education in the state. I say certain ones. These are post-secondary institutions that award 2- and 4-year degrees and have participation in federal financial aid programs. So they are required to report on a number of variables. The statute calls for a report out on specifically on retention rates from first to second year students for all of these institutions, and then specifically on graduation rates for both the 2-year programs and the 4-year programs. You'll note, and I will be pretty specific on cohorts, but for the 2-year programs, this is within a cycle for graduation within 4 years and a graduation within 6 years for our 4-year degree program institutions. This does not include any institution in the state of Maine that only offers graduate work, for example. So there are a number of institutions that only offer master's or above degree in the state at this time. So for this report, the data for graduation rate follows the fall 2017 cohort for our 2-year program institutions and the fall 2014 for a 4-year program. So there's a little bit of a separation in time due to the manner in which this information is reported to the U.S. Department of Education. The prime sources of data are from the Integrated Post-Secondary Education Data System, or IPEDS as it's known as. This is a part of the US DOE's National Center for Education Statistics. We also employed the data from the Carnegie Classification of Institutions of Higher Education. Within the report requirements, there's not only a need to report on the specific retention and graduation rates of our main institutions, but to also provide some comparable data for comparable institutions. So for example, if we're talking about Bates, Bowdoin, and Colby, you'll note that there are peer institutions that are noted in the report as well. The Carnegie classification system has been around for a little over 50 years, and this would be an opportunity for us to use their classification system to benchmark against specific institutional characteristics. So for example, you'll note in the report in tables 6 and 7 there are listings of multiple columns. In that column, it'll be basic classification. So for example, an institution would be noted as a doctoral university with high research activity, or it might be associate's college with high career and technical, with high traditional. So there are a number of classifications that gives us a better chance to identify appropriate and comparable institutions for these data sets. We also did include 2 additional data sets for the tables 3 and 4. These are for an understanding or greater understanding of the students that tend to matriculate and enroll at these institutions. So we added data sets for first-time students. This gives you an idea of the first-time rate at a particular institution. So multiple institutions are 99% of their students. That's their first institution that they've attended or matriculated in. There are a couple other institutions where that rate is much, much lower, and that tends to mean that there are transfer in opportunities. So maybe someone started somewhere else and then they've left that institution and gone to another institution for programmatic purposes, financial reasons, whatever it is for mobility purposes for that student. We also included the transfer rate, and that's a transfer out rate, not a transfer in rate. This is just to provide a better understanding that while maybe a graduation rate might appear to be low, again, it may be because a particular individual is going to that institution to get a basis for academic purposes to continue on in their educational career at a post-secondary institution. While there are 7 tables throughout the report, it was thought to maybe just highlight this specific one right here. This is the national data. So again, the report requirements are to report out the individual institutions' retention and graduation rates, to provide comparable peer institutions, but to also note the national data. I would further highlight the fact that while the cohorts that are previously utilized for the initial retention and graduation rates from the initial tables, this one is a different cohort, and it's because it's national data, so it's really a year behind what is present within the rest of the data sets that are presented in this report. So as this statute does not require any sort of recommendations or findings, this is really purely an opportunity to file a report with some publicly available information that's self-reported by these institutions. And at that time, I would say that I have completed the presentation.
Do we have any questions of Mr. Libby at this time? Yes, Representative Brennan. I think you're muted, sir.
Now not. So thank you, Senator Rafferty, and thank you, Mr. Libby. As I recall, I think this legislation was passed back in 2010, 2011, maybe even 2009, to look at these retention rates. And I'm just guessing that when you look at the 2-year retention, you're talking about community colleges when it drops to almost 31%, 28%.
Yeah. So in the reporting, and I know this is noted in the report itself. When you look at, so for example, there might be an institution that awards both 2- and 4-year degrees. It generally will only report out what their primary degree granting authority is. So, for example, a number of those institutions are primarily 4-year degree programs. So there isn't a differentiation between the 2-year and the 4-year. But in the instance that you're inquiring about, a majority of the 2-year program institutions that are noted in the report are certainly 7 of the main community college system campuses, but there are a couple other institutions that are noted in there Maine College of Health and Professions, Beale University, and a couple others that do offer 2-year because that's their primary degree granting authority.
Okay. Because obviously there's a huge drop off between the quote 4-year graduation rate or retention and the 2-year. And so I would assume again that those are looking at community colleges. At the same time, there also seems to be, did you find anything more in terms of differentiation between for-profit retention graduation rates and public universities?
I think the data speaks for itself. At this time, I don't have any sort of findings or anything that I would highlight at this time. My hope is that I believe our hope is that the reader or the viewer of this data set will come to their conclusions with the data sets that we've provided.
Okay, thank you.
Thank you, Representative. Any additional questions, folks, of Mr. Libby at this time? Yes, Representative Dodge.
Thank you, Mr. Chair. I hope that at some point there will be an overlap of your information and findings with some folks from the community college system in regards to certificate programs and how they will be reported, particularly for students who may come in only for a semester or two to receive a credential and then leave, though they have completed that credential, and how that might be, how that might affect these numbers, number one. And number two, also, is there a way to quantify the effects of the more recent supports that have been utilized both at the community college system and at the university system to assist students in any number of ways, tutorials, social adjustments, those sorts of things. I hope that we'll be able to get a little more coalesced info. The third thing is about how all of this will be reflected and reported out, say 4, 5, or 6 years hence, if it's in these 4-year chunks, and what we might expect about the impact of COVID on the reporting and going forward. Thank you very much.
Certainly, I'm recording those questions and will be in touch with my colleagues at the Sam Warren and Becky Smith at the respective institutions.
Thank you, JC.
You're welcome.
Thank you. How about Representative Salisbury, followed by Representative Stearns?
Thank you, Mr. Chair. My question was just to follow up. I understand that this is just a reporting out of strictly of numbers, and I appreciate that information. I'm wondering, is there any kind of mechanism that we have or will have going forward to get into the details of, now that we have this information, what are the ways that are being, what's being looked at to try to address some of those, that drop off between the 4-year and 2-year, and how can we address those, and what are the barriers and that sort of thing?
Again, I will share that with my colleagues at those institutions so that they can prepare.
Okay, that would be helpful. Thank you.
Thank you. And Representative Stearns, please.
Thank you, Mr. Chair. JC, I have one more on your list.
Okay.
When I looked at this, the last time I looked at this, probably 6 or 7 years ago, there was a great discrepancy amongst the community college campuses on retention rates. And one of the pieces that was involved, and I don't know the exact term for it, but they would allow people to come in as freshmen or first-year students and not receive credits, but go through their work. And the results were dismal. The statistical results of that were dismal. And I always maintained that they'd be better off to work through their adult ed program or back at their high school for that without paying tuition and get prepped up and then be ready for community college. Long-winded way of asking, is that practice still in effect? Could we look at those across the community college campuses? Because some folks had excellent retention rates, and in my opinion, they were being more selective in the students that had done the work and were ready for success at that level. So I'm wondering if we could get a breakout on that.
I will certainly be in touch with Becky Smith about that. I've added that to my list.
Oh, thank you very much.
Thank you. Do we have any additional questions at this time, folks? All right, well, thank you very much. It appears we are through. Thank you, Mr. Libby, Ms. Holmes. If there's anything else you'd like to add, I'll give you a minute.
We will certainly be back in the next series of weeks. We're aggregating our reports by topics so that we can do them in batches for you. And then perhaps not doing all of them as formal presentations, but submitting them to you and then being available for questions and answer opportunities.
Thank you. We appreciate that. It gives us a chance to look at things in advance. But well,
exactly.
You folks, thanks for your work and you have a great day.
Thank you very much.
So folks, this will bring our committee to a close this morning. If there are any questions or issues, I do know the only thing that we'll be planning our schedule of moving forward with myself, Representative Brennan, Stearns, and Senator Woodson shortly. But Representative Brennan.
Yeah, thank you, Senator Rafferty. I just wanted to let you and the committee know I do have a doctor's appointment tomorrow at 9:30, so I'll be a little late getting to the public hearings.
Thank you for that heads up reminder. I appreciate it. And I'm blanking, Hillary. Are we going to stay on this Zoom or are we moving to another Zoom to talk about?
Nope. Senator Rafferty, Senator Woodson, Representative Brennan, Representative Stearns. I'll send out a quick new link in the next 5 minutes as soon as we get done here.
Okay, great.
Give me a chance to find it as well, though. All right. Folks, in the meantime, thank you very much. We appreciate you being here with us this morning. Stay warm and we'll see you tomorrow.